Welcome back. Thank you for joining us at the For Your Best Self podcast. It's exciting to be back in the studio, and I've been really looking forward to this episode. It's sometimes hard to get multiple doctors together, but I'm welcoming a friend and new colleague. Dr. Renee Gasgarth is joining our practice. Those of you who follow along in our newsletters and website and social media probably know. And this is going to be a great episode, taking a deep dive, getting to know Dr. Renee Gasgarth a little bit better. So welcome.
Thanks. I'm excited to be here.
Dr. Gasgarth is probably one of the two smartest people I know, including my other partner, Dr. Anita Saluja. So, it was an easy recruitment knowing that Dr. Gasgarth would just synergistically enhance our practice with her care. I know you care and you work hard and you have a good heart and you're a good surgeon, a good doctor. So those are the reasons why we brought you.
Thanks.
So welcome. No pressure. All right. So tell us about you in a nutshell.
So I grew up in Florida. I'm actually one of the true Floridians. I was born and raised here, and my family lives on the other coast in a small town, Port Charlotte, which kind of has the same vibe. You know, everybody knows each other. Mm-hmm. So in high school, like, definitely people's parents would call yours. Like,
that's good.
You know, I liked that.
Yeah.
And I, of course, as a 17-year-old, wanted to go to a city. Right? when everybody knows everything.
I feel you. We grew up in similar small town situation.
Exactly. And then we both made our way to Miami. So I went to Harvard for college, and I loved it, except for just it was dark. And when you're used to Florida weather and the sunshine, I always tell people I was lucky that we'd have to come home before exams for winter break. Was before exam. So I'd get sort of sunshine and my family and things like that. And then I just kind of marched my way back down. So I went to Emory for medical school and general surgery.
Which is a neat parallel because that's where Dr. Saluja did her dermatology residency.
Exactly.
Not at the same time.
Yeah, not at the same time, but it's funny to think how lives overlap and how you kind of meet people at different times in their journey. And so, I can say that I know her training and she knows mine.
Right.
So
absolutely.
That's pretty amazing. And then I came down to Miami where I met you.
We did 3 years of plastic surgery training beyond our 5 years of general surgery training. And it was, it prepared us pretty much for anything.
Yeah. And I think it's interesting because your college experience and your general surgery were very different than mine, except for they were both pretty intense programs,
right?
Still pretty hierarchical, dominated by men, both in terms of faculty and residents. And and then we came to Miami and we were the first women who'd been in the program for a long time.
Right.
And there were 2 of us.
Yeah, it's still, a lot of my female medicine and surgery friends say the world is still not ready for us. So things are changing, but it's hard.
Yeah.
So from general surgery, what kind of clicked in your mind to shift you into plastics?
When I was a medical student, I was interested in plastic surgery. There was one of sort of changed the field of plastic surgery, Dr. Yurkiewicz, and he was still alive at the time and was lecturing, and he was really supportive of female surgeons.
Wow.
And so he definitely didn't have any in his graduating med school class, any in his surgery residency, any in his plastics, but he sort of felt like that it was time to change. And he was a big proponent of you have to get people who are different to make advances. And so when I met him and just he would give mini lectures and was really still loved his field. And he said, I think you would be good at plastics. You're just really interested in people and you're interested in the science, but you're also interested in kind of the artistry of it. But of course, at that time in general surgery at Emory, everyone was like, you can't do that. You have to save lives,
You really had to hide your interests. It was the same way in my program.
Which is funny to think because we are the surgeon's surgeon, right? So when general surgeons or surgical oncologists can't figure something out,
Collaborate.
Yeah, we collaborate. And then it's sort of an easy relationship.
Right.
But when you're training, it's this idea of that you're not hardcore, you're not dedicated, you know? And I don't know why that is, because the relationship post-graduation is not like that.
Right. I think that part of that is probably just society's perception of what they see as a plastic surgeon is maybe the glamour.
Right.
And, you know, I think if you care hard in any field, it's hard work.
Right.
And, you know, in plastics, it's just a lot of it is elective, and, you know, that comes with its own stress of, you know, there's really no margin for error. But I agree with you, and training that drew me that, you know, you were working with orthopedics, you're working with neurosurgery to cover defects, oncology, orthopedics, urology. You really covered that scope of surgery, which is why we fell in love with surgery in the first place.
Right. And I think that to have sort of a challenge intellectually, so that there were moments when you sort of thought about something in a different way.
More problem solving.
Right. And that it was always interesting.
Right.
So you weren't just memorizing the steps of a surgery, you're really sort of thinking about what to do. And then I also sort of felt their relationships with patients were just very different. You know, because it's elective, we get to spend more time with people. We get to form relationships that last longer.
Right.
And then we get to operate all over the body and on patients of different age ranges.
Yeah.
So
head to toe. Yep. I felt like in general surgery, the farther I went, the more I was kind of given a diagnosis or compartmentalized to like, oh, I'm going to operate on the colon the rest of my life or a different part. But yeah, I missed the head to toe and the creative. You know, you could, within reason, there's certain safe ways to do things, but there's different techniques or different ideas about how that might be accomplished.
And our field changes a lot.
It does.
I mean, in terms of really changes in surgery, right? There's robotic surgery, which has changed, but the actual steps of the surgeries really haven't.
Right.
And then OB-GYN has had a lot of changes, but really plastics has changed dramatically.
Yeah, I think it changes the most with scientific advancement.
Right. People really study it and think about it, and there's a lot of minds that get together on how to do things differently and better, and technology.
And how to solve more problems like lymphatics and things like that. And we're getting all nerdy.
Yeah,
we're getting nerdy on plastics. So for our audience, for those who might not know, it is a long road. How long does it take your average physician to become a plastic surgeon?
Right. So hence you can tell we're nerds because we are overeducated and just kept going to school. So it's 4 years of university, 4 years of med school, and then we both did 5 years of general surgery and 3 of plastics.
Right. Or some people do 6 years of plastics out of medical school. So we did 16. the more traditional,
you have
masochistic.
You have to be a nerd to do that. You have to be.
So what you've been in practice, you know, I'm very reluctant to say our new partner, Renee, is not new to surgery. We trained together, you know, we kind of had talked about by the time your surgeon has graduated from their training program, they've done
at least
7,000 to 10,000 cases of surgery. So you, after Miami, you did specialty training with a pretty famous surgeon in Atlanta.
Right.
In oculoplastics, facial
and
plastics, aesthetic surgery.
And breast. He was really well known in breast. He's deceased.
Dr. Kodner.
So
written a ton of papers and lectured all over the world. So I think that makes you stand out. From all your training, what brings you the most joy? What 3 procedures do you get excited about?
So I definitely love soft tissue. That's what I learned. I'm not a bone person, right? Definitely not a hand surgeon. So I love blepharoplasties. I think we talked about that. We both love blepharoplasties. It's just a surgery of millimeters. It's interesting. we can change people's vision, and we can also just make them look exactly like themselves, but a little more refreshed, which is nice. I love facial aesthetics, so facelifts, neck lifts. That's the nerd in me that really geeks out on the anatomy and getting to sort of really think about someone individually, both their bone structure, how they've aged, and trying to recreate that. And then
It's definitely not a one-size-fits-all procedure. Yeah.
Right. And really talking about people's goals, sort of what's important to them. So that is really very specific to people. And then I have to say, I do love breast reconstruction. I do. I love it. I think those surgeries are hard because there's a lot that's not under your control, and they are complicated, and there's complications, but I love those surgeries too.
Breast can be extremely rewarding. Obviously you're dealing with a disease in a lot of cases, and it's just a lot of relationship and trust and getting people through. It's intense. So I agree. Those are all noble. And how would your younger self react? We joke that a lot of plastic surgeons say that they were born to do this or made to do this, but what would your younger self say about you being a plastic surgeon now?
I don't know if I'm allowed to say this, but she'd be like, "You're a badass. I can't believe you did this." Would have been kind of shocked. We do things that I didn't even imagine, can you remember the first time you saw a facelift? You'd already had medical training. You're like, that is crazy, And just, I think, probably surprised how much I love my job.
Right. It's really humbling when a lot of my friends say, like, wow, like, you really like what you do, and I do, like, it, 99% of the time. The other 1% is
there's always, we were talking about that. There's the 1% that sometimes feels like a lot.
Is this worth it? I agree. I think my younger self would be like, wow, you got your stuff together. And that's awesome. In your free time, what's your favorite thing to do?
Right now, it's honestly doing anything with my family and friends.
Yeah.
So my son Theo is 3, so pretty much anything outdoors with him is fun.
Yeah.
Got him like a fake fishing rod, and honestly, that's been the best because he's so excited and just spending time. I'm not one of those people who's like, there's an activity. I know your husband loves surfing. I don't think there's any activity that I love that much. It's really just sort of spending time with the people you care about. I
agree. And everyone says Brevard is just such a phenomenal place for families and communities. So
coming from South Florida, to have a street that your child can ride a bike on, and you don't have to be scared. Just the safety issues, all of the parks, all of the beaches, the zoo, so all of that. Theo's very excited about the beach. We've been talking it up.
Our zoo is a gem too. It's a total gem. So on similar, what do you most miss about pre-COVID days? Talking about connection and
we've sort of talked about this. The mask thing is very strange. So meeting patients with a mask on.
We've both been vaccinated too.
Yes, we're vaccinated.
And we're not even in the same room.
Yeah.
We're 6. We're podcasting remotely.
I got the blue cool room. So that's sort of strange, that I've operated on patients and never actually seen their face until the day in the operating room when they have to have anesthesia. And I think that communicating with patients is just very different.
Yeah. A lot of what we do is so much based on trust and comfort and establishing that rapport. It is.
Right.
We can show them. They've seen our pictures, but
it's just different. I think I'm a pretty expressive person. So, when you're like, I'm smiling under here.
Smile with your eyes. That is true. it is harder to connect. And so
it just feels really different.
Yeah, like you kind of have to go out of your way to make people feel safe and comfortable. Along those lines, being under a mask all the time, what have you noticed has been more in demand with mask wearing and COVID and Zoom? We talk about Zoom face and Zoom neck, and I feel like people are just examining themselves a lot closer.
Yeah.
I have more time to be critical of themselves.
I think that people are just more interested in facial aesthetics in general. You know, and I think that the mask eyes are a real thing. The demand in men, for example, for eyelid procedures and Botox is much higher, because I think people are
looking at their upper face.
Right. And then all of the Zoom things, you know, the face and neck. And we were talking about that. Some people are just not interested in surgery, so they're interested in sort of rejuvenation and options. But also people look at it as like, I'm working from home. It's not a bad time to hide things with a mask. It's interesting.
Yeah. A lot of people are more willing to go into construction or have more flexibility in recovery time.
You know, or people are sort of saying, like, for a CO2 peel, I'll take the full week off. I don't need 48 hours.
Yeah. I think also, too, you're not spending money on vacations and traveling and plane tickets. So you're like, a lot of people, I think, are saying this, I'm going to invest in myself this year or in time.
And I think that all goes together with people are sort of really thinking about what's important to them. But I also think that some people are just sort of thinking, you know, I don't feel like this vision I see in the mirror. I actually am grateful for my life. I'm still healthy. I'm active. And when I look in the mirror, that doesn't match.
Yeah.
And I think that's...
Or the computer.
Yeah, or the computer. And that sort of made them a little more willing to sort of invest the time and energy to at least think about it.
I agree. It is. We've been busy, which we're grateful, but we can't work from home.
No, it's not work from home, but we're vaccinated.
So we talked a little bit about the zoo and the beaches. What else are you looking forward to about joining the community in Brevard?
I mean, a big part of it is definitely our practice. And it's true. I think, you know, to get to work with a friend who's an awesome surgeon and just a good human being, and then Dr. Saluja, and you guys have really built something awesome. I think that's hard to do. So to have people who are really excellent technicians, good people, and build a great practice.
It was kind of fun, I have to say, the last week. Dr. Gasgarth's been with me in clinic, just learning the flow, and she's graciously covering me on my maternity leave as well. But it's like every staff member I got to introduce her to, I'd be like, they're a rock star. I'm like, wait, they're a rock star too. And it was like, no, everybody's a rock star.
I really felt like that.
Like,
I was
so
like,
proud
wow.
to show everybody off.
I know.
And,
you know, it's amazing. I'm like, wow, that's awesome. Wow, that person's awesome.
And then, you know, I think our space is beautiful and our patients are nice. And
our patients are going to be just amazing. It's great. So, and then I mean, I'm really looking forward to being part of a community. I think that's one of the hard things in a city when there's lots of visitors and people are moving in and out. I know. She's like, our people are the best. They're happy tears. So being in a small town and really getting, especially because it's just me and Theo, being part of a community is really important to me.
It's awesome. It does feel like it's a big small town. Yeah. I mean, I think there's enough to do and enough support, enough activities, but it's also fun to be a part of a community you can add to and bring great things to and good families. What is your favorite thing about being a plastic surgeon?
It's definitely the patients. You know, I think that people probably would be surprised how much we care, how much sort of time and energy we think about our patients. And, you know, we were talking about that. I had a voicemail from an old patient, and it made me emotional. Like when someone says thank you, and I feel like I should be thanking for her for letting me take care of her. Yeah. So it's definitely our patients.
It's pretty humbling.
Yeah.
What we do. What is the hardest thing about being a plastic surgeon? Caring.
Yeah.
Caring too much.
I know. It's that 1% we talk about when, you know, the patient's not happy, or you're looking at it and like, I wish this outcome had been different.
Right.
Caring and being a perfectionist, you can't, you take that home.
Right.
And you want things to be perfect all the time. And the reality is that's not life in or outside of the operating room or office. So
absolutely.
I think that makes it hard.
So along those lines, what is your favorite thing about being a mother?
I mean, it's Theo.
Yeah.
I feel like I got super lucky.
Yeah.
I tell people that. He's just, they have their own personality, and he's just very loving and really funny, and he makes me think about things in a different way, and I think he's made me more patient, and just my heart's bigger.
Right.
So, when everyone asks, like, oh, it must be so hard to be a mom and a surgeon, I'm like, no, it's not. It really isn't. That part's easy.
And the hardest thing about being a mom?
Childcare right now.
Reliable childcare.
Yeah, I mean, I can't do my job without childcare.
We're a little bit of control freaks. Like,
I know.
Like, I need to be on time.
Yeah, right. I mean, it's not kind of the thing where you call out sick because you don't want to if you have patients depending on you.
Our rule is you can only call out sick if you're in the hospital. If you're admitted.
Yeah, you better be getting an IV. We do let you have childbirth, just so you know.
That's right.
That counts. That counts. You can go into labor and go to the hospital.
I think, too, I liked in our off-camera conversation when you said just being present takes practice, and making that switch when we're at work. We're not daydreaming about our life. You're really one patient at a time, one patient in front of you. Like, that's really all you're focusing on. And then when you go home and have to turn it off.
Yeah. I think that is true. That probably is harder than childcare in general, but right now, childcare. But the idea of that to really be, if your child came in as a patient, it'd be super easy to shut everything off and just pay attention to them. But when you're at home, to not check your email, to not worry about something, to not sort of want to be getting ready for the next surgery or the next cases, to really be present and in the moment. And I think Theo made me realize I didn't do that. In general surgery and plastic surgery, you kind of worked however long you needed to work, and the hours were fine, and then
you just slept and ate.
And then you slept and ate and did it again. So, by the time you got like a full weekend off, you basically were just sleeping, eating, hanging out with friends.
Right.
And now you have to really be present every day. They deserve that, and that's hard sometimes.
I agree.
I mean, Theo will sometimes, he has a play phone, and we'll walk around and be like, okay, doctor, I'll get back to you. I'm like, do I do that all the time? I'm like, yes, I do answer the phone with him in the background. So I do. That's like the reality of my life. And he'll pace, because I pace when I answer the phone. So he'll walk around on the phone. Okay, sure.
Yeah, Bea's 4, and we're finally to a point where I can pick up the phone at home and her not have a total meltdown. Like, I did all my talking in the car.
We're not there. I'll hold him, but you'll hear him.
The struggle is real.
Yeah, the struggle is real. But it's also sweet that he likes to pretend to be a doctor too. Yeah. So I know that, as much as it's hard for him sometimes, I know that he also sort of is excited that I like my job and I come home and I'm into it. Yeah, he asks questions. My sister's son had pink eye, and he was pretending to like be the doctor to give him eye drops. It's cute. Yeah.
They care. B says she wants to be a doctor. I said, why? Well, so I can go to the office with you every day. I'm like, well, gotta work on your why, because you don't really have to go to that much schooling to come with me.
You're like, talk to daddy. Anesthesiologist's not bad.
It's been awesome catching up with you, and I can't wait for patients to meet you, because they're going to fall in love, and you're going to succeed. There's no question. What is the best way for patients to reach out to you, get in touch with you?
So one of the great things about me now is that I have time to meet you in person in the office, and it's super easy to get hold of us. We have a website, Facebook, social media, including Instagram, and then, we answer emails, and you can always call. So happy to see people in office and meet you in town.
Dr. Gasgarth's schedule opens April 5th. It's filling up. So call and get your consult, or start following us on Instagram, Dr. Novo, our website, www.foryourbestself.com. Dr. Renee Gasgarth's bio is up and live, and we're going to be upgrading our website with some great photos.
Yeah, that's one of the nice things again, female practice.
So reach out, and we look forward to seeing you in the office.
Definitely.